The tissue specimen comes from a 19-year-old male who had pain from his ankle region when weight bearing. An X-ray showed that within the talus bone there was a 2.5 centimeter in greatest dimension round lytic lesion within the bone. The tumor has well circumscribed margins, which also shows a zone of sclerosis. Within the middle of the lesion, very faint, subtle areas of radiodensities are present. The clinician did an open biopsy and curettage and generated this specimen, which on the slide consists of multiple irregular fragments of tumor. There are very few pieces of pre-existing trabecular bone present within the specimen. The tumor varies in color from pink to regions that are more purple. The purple areas are foci of dense cellularity. The neoplastic cells are moderate in size. They tend to be oval or elongate and have a moderate amount of eosinophilic cytoplasm that is either eccentric in location or evenly distributed throughout the cytoplasm. The nuclei are large and many have irregular contours and others have nuclear folds. Also present are occasional small nucleoli within some of the tumor cells. The tumor cells are arranged either singly, where they are surrounded by a small amount of eosinophilic matrix, or grow in sheets. Also present, scattered throughout the tumor, are multiple multinucleated osteoclast-like giant cells. The nuclei within these giant cells have a different morphologic appearance than the nuclei within the tumor cells. The nuclei within the osteoclast-like giant cells are prominently vesicular and have conspicuous nucleoli. Looking in different regions of the tumor, in particular the areas of the tumor that are pinker in color at low power, we can appreciate the presence of extracellular matrix. The pink matrix has somewhat of a fibrillar quality to it and surrounds the individual tumor cells. The neoplastic cells are relatively uniform in size and shape and show infrequent mitoses. This matrix is considered to be a primitive type of neoplastic cartilage, and the combination of the matrix, the sheet-like growth pattern of the tumor cells, and that the neoplastic cells have irregular and cleaved nuclei are characteristic of chondroblastoma of bone. Chondroblastoma of bone is a rare, primary, benign cartilage tumor of the skeleton. It usually develops in relatively young patients in the early to mid to late portions of the second decade of life. It often develops in the long tubular bones such as the distal femur and proximal tibia, and is relatively unique in that it originates within the epiphysis of the bone. A common finding in chondroblastoma, which is not present in this case, is calcification of the extracellular matrix around the individual tumor cells, imparting a so-called chicken wire-like pattern of calcification. Chondroblastoma is one of the few primary bone tumors that also contains many osteoclast-type giant cells within the neoplasm. Other tumors that may be rich in osteoclast-type giant cells include giant cell tumor of bone, tenosynovial giant cell tumor arising in the synovium, secondarily eroding into bone, clear cell chondrosarcoma, and a brown tumor of bone. Their morphologic distinction can be made by evaluation of the mononuclear stromal cells, which are considered to be the neoplastic component of the tumor, and that the osteoclast-like giant cells are non-neoplastic and likely entered the tumor via expression of cytokines secreted by the chondroblasts, which are chemotactic for the influx of osteoclasts.